Hey, welcome back to Know Thy Health. Today, we want to talk to you about healthcare sharing ministries, the good and the beautiful of healthcare sharing, and as well as some of the gotchas and some of the things you should be aware of as you look into healthcare sharing programs and their options and their alternatives to health insurance. The first thing we're going to talk about today is the regulated versus like non-regulated approach of healthcare sharing. While they are you know legal entities, they're not regulated insurance companies, as we know. And so we want to talk a little bit about that. So I want to hand it over to our actuary and CEO, the risk whisperer, Daniel Cruz, to give us an insight on that.
Thanks, Cameron. Yeah, this is a really important topic that often gets misunderstood. And I think part of the problem when you think about health sharing, healthcare, health insurance is really for most Americans, it's a opaque, non-transparent, complicated thing to begin with, even though 93% of Americans have insurance. Many Americans don't even understand how their own health insurance or health plan works. And so the first thing is to dispel some of the language differences out of the gates, which is, health sharing is ultimately risk sharing. You are contributing to a health sharing ministry organization, a nonprofit organization that pools risk. They don't call it a premium, but you pay a monthly amount that functions as a premium with the purpose that ultimately, if you have some large catastrophic medical incident, there's money there to then pay those medical bills. So health sharing equals risk sharing, and risk sharing is essentially health insurance. So these are really just different terms describing the same exact thing. And really the big difference between, say, a health share and a health insurance company is that, again, like you said, Cameron, teeing this up, one is regulated, that's the health insurance company, and one is not regulated, which is the health sharing ministry plan. I think what as I've thought about this, how to help people kind of understand this better is kind of bring an analogy into play for another highly regulated industry, which is the airline industry, which I think we can understand a little bit more of why there's regulations in place there. So to start off, like you could think about like, um, you know, in an imaginary world, if there was a situation where the federal government said, for a Christian version of an airline company, we're just not going to regulate this nonprofit Christian airline company as long as they call it something different than an airplane. You can call it like a Skyrider or whatever you want to call it. But the point is that whether or not you call it an airplane, a Skyrider, or whatever it is, at the end of the day, like an airplane that has to go through the air is subject to the same laws of gravitation, just the way when we talk about health shares and health insurance, it's subject to the same laws of statistics that you need to come into play, that there's money there when these catastrophic low probability situations happen, like heart attack, stroke, etc. Right, so we're going to get into that in a second, but I think the first thing that I want to start off is why the health shares came into prominence, why they're a good thing, why they've actually served. Now it's close to 2 million Americans and really exploded after Obamacare, which is, let's start with why it's good to not be a regulated entity. So one of the biggest problems with regulation is that it can balloon the cost of a health insurance product. And we all know what happened with Obamacare. It came in around 2014, a new individual market product, and the regulations that were put in place really created winners and losers by ballooning the cost for a certain segment of the population. So the biggest thing is that it created a guaranteed issue environment, meaning like if you have a current condition, the insurance companies can't deny your coverage. So you could have active cancer treatment. You could, have just had a heart attack, and insurance companies have to take you. So it's made the risk pool in the insurance environment, the Obamacare environment, very unhealthy, meaning the costs are very high. Now, with regulations, whenever there's regulations, they create essentially a path for winners or people that are helped by it, and path for people that are essentially hurt by it. So the winners in Obamacare were low-income people got subsidies to take away that high cost. And then, of course, those that have current conditions like cancer, they just had a heart attack or something, like, obviously they're a winner because they can't be denied, right? But there was a whole segment of the population that didn't receive subsidies and are healthy. And these people had to bear the burden of that ballooned cost of a regulated environment, right? And so that's really the beauty of where the health shares were able to help out and why they catapulted to success after Obamacare was that they were allowed to, number one, exclude members with pre-existing conditions. Now, that's a some would say that's a bad thing, but the reality is if you have a pre-existing condition, the federal government created a great avenue for you to get care. So it's a good thing in the sense that it allowed for an opportunity to create a healthier risk pool that people who are unsubsidized and healthy can save thousands and thousands and thousands of dollars by joining these health share ministry programs. So I want to start off by saying like there are good aspects to not being regulated, and cost is one of the biggest things. Now, what's not well understood and what's really important if you're on a health share or if you're thinking about a health share is to understand some of the downsides of not being regulated. So again, I'm going to draw on this airplane analogy because I think it's helpful, and I'm going to just talk about like two reasons why regulation is important for consumers and why it could be risky or dangerous to say go on a health share that's not regulated. So reason number one is that in the health insurance industry, you essentially have pilots, trained, certified, professional pilots flying the plane. In the health insurance environment, these are called actuaries. Now, actuaries are trained for 5 to 10 years to develop premium rates, the amount that you pay monthly, at a right statistical level that's going to make sure that that money is going to be able to cover these catastrophic events, right? So you don't want to create premium rates that are too high, or you especially don't want to create them that are too low, so that like when people need the money, the insurance company doesn't have it, right? And so it's like a pilot that has done thousands and thousands of hours of flight training to make sure that they are piloting the plane correctly. Now, health shares do not have to use actuaries. Now they can use actuaries, right? But they're not required to use. So when you're going on a health share and you're paying a monthly premium and you're like, "Hey, it's so cheap. This is great." Well, you should pause and say, maybe it's too cheap. Maybe they didn't have a certified actuary think about this properly, and actually they haven't funded this well, and when you need your bills paid, they haven't collected enough to actually pay it, and you're going to be left in a problem, right? So that's number one. Number two is that when we talk about developing a premium rate, you're talking about like on average what's the monthly amount you need to collect. Well, if you draw from your wonderfully exciting statistical class from high school, there's something called a normal distribution, where in reality the actual costs are going to be either too high, too low. It could be really high, could be really low. You don't really know, right? And so in order to combat this, regulations in the health insurance industry requires insurers to have a certain amount of capital reserves or cash available, so that if their actuaries got it wrong, they still have money on the side to make sure those bills are paid, right? And so in the airplane analogy, I like to think of this as like when you go on a commercial jet, you know that they have two functioning engines, and they actually have even a backup generator in case both of those engines go out to help them make sure they land the plane. So with the pilots, with all the backup engines, it is extremely, extremely rare for a plane to crash. Not that it can't, but it's like very, very rare for this to happen because of those rules and regulations. Now, the health shares, once again, they can have the money, they can have additional reserves and function just like a health insurance company. But the thing is, you don't know. So if you go on that airplane, you don't know if you're taking off with one functioning engine, two functioning engines. Do they have a backup generator? Who's flying the plane? You just don't know these things. It's really at the discretion of the health share whether or not they actually put these safeguards in place. So there are goods to regulations, but to really understand some of the problems, it's helpful to kind of think about the risk that is involved. And really the risk is that you just don't know if they're doing this properly. And again, what's the downside if an airplane crash? We all know. The people die on the plane. It's catastrophic. It's terrible, right? What's the problem if your health share doesn't have the money to pay the bills? It's catastrophic. If you have cancer, if you have heart attack, if you're sitting on $200,000, $500,000 bill, it's a financial wipeout of your family, right? So it's the reason why regulations exist in both of these industries is because the downside catastrophes are very, very large.
I mean, and I know health shares well, and like we've said before, it's not a big deal till you're bankrupt, right? I mean, I think that's the risk that that a lot of the health shares are that the members are taking is it's not a big deal if you don't get sick. It's not a big deal if you don't get cancer, but it's a massive deal for your family when you're bankrupt.
Yeah, I would just say on the regulation point, I think, most of these healthcare sharing ministries try to take like this whole biblical approach of like Acts 2, right? Where these Christians are I say these Christians, but Christians are sharing resources, right? And bearing each other's burdens. So and also giving the church or the ministry, right, the autonomy to take care of the sick, not the government.